This program is brought to you in part through a grant from Integrative Therapeutics. When results matter, you've made the right choice with ITI. The American Health Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. This week, the American Health Journal presents a special report, Discoveries in Alternative Medicine, with your host, Roger Cooper.
Hello and welcome to the American Health Journal special report on Discoveries in Alternative Medicine. I'm Roger Cooper. Our program today focuses on naturopathic physicians, doctors who are trained in the art and science of natural medicine. Although it almost disappeared in the mid-20th century because of the popularity of drugs and surgery, naturopathic medicine is making a comeback as a natural, vital part of the healthcare system. First up, the changing threats to our health. Once the risk was infection, now it's our lifestyle. Later, we'll look into the natural approach to the treatment of debilitating chronic illness. Then, living with chronic illness. A naturopathic doctor says there's hope. Also, a referral to a naturopathic doctor for nutritional counseling leads to a life without medications. Then, studies show the level of neurotoxins in our bodies can lead to disorders such as Parkinsonism. We'll see the hope offered by naturopathic physicians. In the past, the greatest risk to our health was from infectious diseases. To find out how that's changing, we talk with Dr. Paul Mithman, President and CEO of Southwest College of Naturopathic Medicine.
Well, for the first time in human history, the problems that our public is facing is not acute diseases, but it's chronic diseases. Until about 50 years ago, one of the number one leading causes of death was pneumonia in the United States. Today, it's diabetes, it's heart disease, it's cancer, strokes. We have arthritis, we have stomach and gastrointestinal diseases. And the difference between the two is that in the past, most of those were infectious diseases. And those were, if not conquered, they were greatly minimized through the advent of antibiotics and sanitation, having clean places to live, clean drinking water, etc. Today, out of the over $2 trillion that we spend on healthcare in the United States, the overwhelming majority of it is spent on treating chronic diseases. And of those, heart disease, diabetes, cancer, probably 80% are preventable. And that's where naturopathic medicine comes in. When I say preventable, they're preventable because of dietary interventions. Really, it's really true. You are what you eat. And when it comes to these kinds of conditions, what we eat, unfortunately, is leading to an epidemic that is bad now, but in the next generation is going to be even worse.
To find out how naturopathic doctors treat chronic disease, we talk with Dr. Jane Giltinan, a professor at Bastyr College in Seattle, Washington.
The conventional medical approach to chronic diseases is with drugs or medication to control symptoms and possibly to control or prevent complications from the disease. For example, if you had an osteoarthritis or a degenerative arthritis, the conventional medical approach would be to give anti-inflammatory drugs to suppress the inflammation and potentially down the road a joint replacement if the joint gets badly deteriorated. A naturopathic approach to chronic disease is quite different, actually, and what a naturopath will do is first and foremost try to look at what the underlying factors are for why the conditions are there that cause the arthritis. Naturopathic doctors believe that in balance the body has an incredibly powerful innate ability to heal itself, and if you give it a chance, it can heal. It can restore balance and wellness and health. So the naturopathic physician will work with the patient to try to understand what are the conditions, what are the underlying causes, what are the obstacles to cure that can be identified and removed so that that person's body can do what it wants to do naturally, which is to heal. Secondly, a naturopathic physician will look at and provide interventions that are the least force possible so that we don't overshoot the mark and do more damage or do harm to the patient rather than good. So the interventions we use will follow what we call a ladder of intervention or a therapeutic order, where we'll use the most simple, non-invasive techniques first and move up that ladder of intervention only as necessary. And then lastly, I think a big difference with the naturopathic approach to chronic disease is the concept that the doctor plays a critical role in educating or being a teacher for the patient to help them understand what's wrong and help them figure out ways that they can feel better and get better.
We are experiencing an epidemic of chronic diseases that has the possibility to overwhelm our healthcare system, and at the same time we have a shortage of healthcare providers in virtually every state, not just in rural or in underserved communities, but throughout the country. And naturopathic physicians have the capacity to add something to the healthcare system today that's not just more healthcare providers. It's people who have a very deep understanding of chronic diseases, the causes, and the solutions. So when I look out over the next decade and the next 20 years at the kind of conditions that we're going to be faced with in healthcare, I see a place that not only is a place that welcomes naturopathic medicine, but a place that's screaming out for naturopathic medicine. Because frankly, it's one of those things where we can't do it ourselves. But a future with naturopathic medicine is far better than a future without naturopathic medicine.
Now, to learn how naturopaths treat debilitating chronic illness, here's our reporter, Laura Windsor.
Sometimes chronic illness can be so debilitating the patient can't even get out of bed. Sometimes chemotherapy is not an option for an individual. To find out how a naturopathic doctor approaches debilitating chronic illness, we talk with Dr. Shannon Sinsheimer in Rancho Mirage, California.
Chronic illness is usually going to be diseases that are autoimmune conditions, such as MS, multiple sclerosis, RA, rheumatoid arthritis, in a severe case, Wegener's granulomatosis. But we typically put those in the autoimmune category because they're ongoing. They can relapse and remit, meaning you can have periods where you feel no symptoms, feel less symptoms, feel the same set of symptoms for a very long time, and then you have an exacerbation of those symptoms. So chronic illness means that it doesn't go away, but you can have varying degrees of discomfort from the disease at different times throughout your life. Chronic illness is usually a palliative treatment, meaning that you treat the pain, you treat the discomfort, and find a way to decelerate the disease process. So when you're treating it, you're not treating the condition, but sometimes the symptoms of the condition.
My eye was red, and my joints were swollen. My knees, my ankles, my elbows, they were swollen, and I could barely walk. After going through that for some time, being admitted into the hospital, being referred to a rheumatologist, he diagnosed me with Wegener's. It's an autoimmune disorder. He wanted me to start chemotherapy. I said that that's not an option for me. You know, I have a baby at home, I have to work, and I don't have time to be getting sick, losing my hair over something, you know, that could be managed other ways. And so then after that, I started looking up naturopathic information, curing stuff naturally. And then I seen Dr. Shannon. When I first started, she's so reassuring, you know, that, you know, everything's going to be okay, because I was so nervous. I was a wreck. My anxiety was high. I had never in my life been sick like this. So after that, when I was talking to her, you know, she was calming, and then recommended me a whole bunch of different kind of supplements. The labs came, the numbers went down. My rheumatologist was shocked. And he was like, wow, these numbers went down significantly. He said, I would never even think about putting anybody on Cytoxin with these numbers. That's chemotherapy.
Naturopathic care treats the underlying cause of the disease. So in the case of Demetra Porter, where she has Wegener's granulomatosis, it's a condition of inflammation of the small and medium blood vessels. When I treated her for Wegener's, I treated the inflammation, of course, because that's the pathophysiology, the disease process, but I also treated her her GI system because her GI health had gone off a little bit, treated her to make sure she was digesting the nutrients and eliminating waste appropriately. I treated her emotional well-being. She was extremely distraught when she came in. She had a 10-month-old. Her body wasn't functioning. She was barely able to move. Obviously, the emotional distress was increasing and exacerbating her condition. Wegener's granulomatosis 30 years ago would have been a condition that could be potentially lethal in the end. And so there's not a lot of great treatments. What they do is slow down the disease process or stop the body's certain body processes from functioning. In the naturopathic way, I look to support her body functions, support the cells, support the joints, support the inflammation process, meaning that I gave her agents, therapeutic, natural agents, that would decrease inflammation by supporting the cellular function.
I'm able to walk, I'm able to go to work, I'm able to do doubles. You know, it's not always good. I'm telling you this, I wake up sometimes and I'm like, oh, my eye hurts, I'm in pain, I don't feel like doing this. But you know what, I'm glad I can get up, because there was a point in which I couldn't get up out of bed. My feet were stiff. It would take me like almost 2 hours just to get out the bed. Now I just jump up, take my shower. I mean, I can remember a time in my life when I was in the shower for almost an hour trying to get in and out. For almost an hour. But now, I'm still in there a little bit long, but it's okay. It's my choice.
For Discoveries in Alternative Medicine, I'm Laura Windsor.
Chronic degenerative illnesses like irritable bowel syndrome have been called incurable. We talk with Dr. Carrie Louise Donnell of Denver, Colorado, to find out if there's any hope. We began by talking with her patient, Margaret Utter, about what life was like with irritable bowel syndrome.
I've had problems all my life and sought out, well, my mother first and then my own self, sought out various medical support for it, and most of the time doctors would say Metamucil is the best thing and that will take care of one issue, or when I was very young, Paregoric, which is, I think, not even on the shelves anymore. So they really didn't know how to really stop it, only to treat the symptoms. And as I grew older, the symptoms increased, and I actually ended up having a bowel resection as a result of the disease that was caused by the bowel not functioning correctly. So I went through the surgery, I recovered from the surgery, things were going beautifully for, I don't know, 2 or 3 years, and then I had another episode which just really threw me over the top. It was very frustrating because I had assumed that the problem was taken care of. Well, I happened to be in the care of Dr. Donnell at the time of this episode. She was assisting me with another issue. And I called her and asked if she might have some protocol that would assist me in this because, enough is enough. And the improvement was astounding. It felt miraculous, actually, because for once in my life, I wasn't having all these unpleasant symptoms. So I continue on a maintenance type program now, unless something comes along like an intestinal bug or something, and then we go right back to a restorative protocol and the issue is resolved.
Digestive health is at the core of most of the chronic degenerative illnesses that we face these days. In real estate, it's location, location, location. In naturopathic medicine and in the health of the body, it's digestion, digestion, digestion. It is amazing what kind of myriad of different chronic degenerative illnesses that you can permanently and completely resolve when you repair the digestive system and restore it to a comprehensive level of health. You know, if you think about it, it's nutrients in, it's waste products and toxins out, and your digestive system houses about 70% of all of your immune system's cells. And so if your digestive system isn't healthy, you're not bringing in the fuel to your body that you need for all of the different organs and tissues to function properly, and you're definitely not ridding the body of all the toxic waste that would serve as an obstacle to cure or get in the way of the body doing its job properly. And if your digestive system isn't healthy, your immune system is compromised in two ways. Both, it's unable to fight things like cancer and infections, and unfortunately, and maybe even worse in the case of chronic degenerative illnesses, your immune system can be inappropriately overactive in something that we call inflammation, where your tissue is chronically inflamed, which leads to a whole host of problems like chronic fatigue, fibromyalgia, food allergies and sensitivities, autoimmune diseases, chronic sinus problems. The list goes on. And what we found in the field of naturopathic medicine is restoring comprehensive health to the digestive system can permanently resolve a lot of these issues for a lot of people.
Before, it was always in the back of my mind, you know, I'm going to be with people, so I must be very cautious about what I eat or what I drink or stand a certain distance from. It's not very pleasant to be around. And now that's just not an issue. It's completely resolved.
I would like to send a message of hope to people who battle chronic degenerative illnesses. Right now it is understood that there is no cure, and yet patients seeking help in the naturopathic world get help every single day, completely resolve their illness, and move on to live their lives fully. Not everybody has every answer for everything, but if you're not finding the answer you're looking for, keep looking. It's out there.
And now a Discoveries in Alternative Medicine quick quiz. What's the best source of antioxidants? Coffee, fish, blueberries, or whole wheat? Your answer coming up. You're watching the American Health Journal presents Discoveries in Alternative Medicine. What's the best source of antioxidants? Coffee, fish, blueberries, or whole wheat? Blueberries are blue because of pigmented compounds called flavonoids, which are strong antioxidants. Coffee contains antioxidants also, but not as many as blueberries. Fish and whole wheat, while healthy foods, are not significant sources of antioxidants.
After being told that her rheumatoid arthritis would be with her the rest of her life, registered nurse Deborah Mahan was sent to a naturopathic physician for nutritional counseling. What she found was so much more, including a way to get off all her medications.
I was diagnosed with rheumatoid arthritis in 1986. At the time it was my daughter's 9th birthday, and I had taken a group of girls to the lake, and one of them jumped on my foot, and when she jumped on my foot it never healed. And so I went to see my family doctor, and he came back with the diagnosis of rheumatoid arthritis. And me being a nurse, I was devastated. And especially when he gave me this sentence of, well, there's nothing that can be done about this. He said, your cholesterol is good, so you'll probably live to be 100 and fall apart a joint at a time. So that was not real exciting to hear. So I went to a fellow named Paul Howard, who was a rheumatologist, and he sent me to Leslie Axelrod. And Leslie was a naturopath who was in his office. The interesting thing was that when he first sent me to her, he just sent me to her for nutrition counseling. He had no idea what he had in his office and all the skills that she had. So part of what I would do is help him explore what she was capable of. And as it is now, I have gone from being on drugs to right now I am on no medications whatsoever. And it is because Leslie has helped me make my body stronger so that I can heal myself.
Dr. Leslie Axelrod explains the naturopathic approach to the treatment of rheumatic disease.
Well, depending on the disease process, conventional medicine varies some. With osteoarthritis, a lot of times it is anti-inflammatories, as well as the early stages of a lot of autoimmune diseases. They will use things like naproxen and ibuprofen, and as well as the lifestyle physical therapy. With naturopathic medicine, what I typically like to do is I really like to get a thorough history and find out what's going on with the patient and go really deep into when it began, what was happening even before it began, and look at their lifestyle, look at any exposures they may have had. Looking at all aspects, their digestion is a very important part, and a lot of times there can be abnormal flora that can be stimulating their disease process. So that's the basis of where I start, and then from there I will decide which direction to go, each patient being different.
At first, I was sent to Leslie so she could help me with the side effects of some of these very toxic drugs I was on. I'm not suggesting that people go off of their meds for diabetes, rheumatology, anything like that, but if you are taking those medicines, the naturopathic medications, the homeopathics, the traditional Chinese medicine, it's an entire package, can make your body stronger so that you may get to the point where you don't need those, or where you need minimal amounts of medications, or you reduce the side effects.
One thing I think if everybody could walk away with is to eat nutrition that will heal your body, to keep moving, and to live joyfully in your life.
This program is being brought to you in part by a grant from the American Association of Naturopathic Physicians. For a referral to a naturopathic physician in your area, go to www.naturopathic.org.
The Centers for Disease Control are conducting studies into the level of environmental toxins in our bodies. Results suggest these neurotoxins can lead to chronic neurologic problems. Dr. Walter Crinnion explains.
Environmental medicine is looking at the health problems in an individual that's caused by a buildup of the toxins that we are exposed to every day in our air, food, and water. So like the United States CDC, Centers for Disease Control, is now doing ongoing studies to say, what are the level of toxins that is in you and everybody else living in the United States of America? Because we're all loaded with environmentally toxic compounds from, again, air, food, and water. So a number of these toxins that we all have in us damage the nervous system. They're neurotoxins. And they build up in the body, and we can develop then chronic neurologic problems. Parkinsonism, or Parkinson's disease, is one of those illnesses that is strongly associated with exposure to environmental toxins. You might say that Parkinson's disease was the poster child for this. It was one of the first chronic illnesses that researchers went, oh my goodness, people could be exposed to this other compound, and all of a sudden they've got Parkinsonism. What's that all about? So when I get Parkinson's patients, I'm looking to find out, do they have an overburden of certain environmental toxins in their body that might be causing their Parkinsonism and might be an obstacle to them getting better.
It was about 8 years ago. I was sitting on an airplane reading a newspaper, and I noticed as I was holding the paper, the right corner of the paper was perfectly still, but the left corner of the paper was fluttering. And I noticed my hand was shaking, and I went to a neurologist at the time, and they diagnosed me with Parkinson's. At that time, they put me on some medication, the usual regimen of Parkinson's medications that you give patients over the last 30, 40 years. Pretty much the Western standards, Mirapex, Sinemet, Amantadine. It works generally okay. It causes some side effects. My sleeping habits are pretty bad. Constipation's an issue. Tremor comes and goes. I asked my neurologist where I could go to find out more about naturopathic medicine, and she sent me to the college here, to Dr. Crinnion. I'm very happy with them. The glutathione IVs, I think, are helping out. We don't have any absolute data that says they are, other than how I feel. It's kind of anecdotal data, but I hadn't had an IV for about a month. I've noticed a real difference in the tremor that I have by not having the IV.
While the whole range of people being interested in organic food, good supplements, clean air, clean water is dramatically increasing, so are people's awareness that there might be something in my body that's keeping me from being as healthy as I'd like. And so I really see in the next 10 years or so more of environmental medicine being more of a standard approach and treatment throughout all the disciplines. And that's thrilling for me because I've seen it give miraculous results to people. I mean, chronic illnesses, autoimmunity. Give me anybody with arthritis, lupus, Hashimoto's thyroiditis. We reduce the toxic load, they get better. And the blood levels of their antibodies goes away. It's like a slam dunk. So allergies, asthma, all these chronic debilitating problems so associated with the buildup of toxins in our environment. And it sounds frightening, but it's relatively easy to reduce the load. You have to spend a little bit of time doing it and some focus and some money, but it pays huge dividends.
My goal is to slow down the rate of progression of the disease. I'm a believer that the technology, medical technology, will move ahead. I hope it moves ahead at a rate which catches me kind of in midstream. So for that reason, I'm trying to do all kinds of things to slow down the rate of progression. And there's a number of things that I have tried over the last few years, and I think they tend to be helping.
It's so wonderful to see patients that don't need to be taking the medications anymore. But more than the fact that they're not spending the money on it anymore, their quality of life is so much better. They don't have these chronic problems, because so much of what I work with, people having symptoms that they think, oh, this is just what getting older is all about. And it's not. It's not that you're adding more days to your years. It's that you're adding more toxin every day to your body load. We reduce that, and your body starts to work just like it should. Regularly, my patients say to me, Doc, I feel 20 years younger. We're just moving out the toxins, and their body works better.
Thank you for joining us for this American Health Journal special report, Discoveries in Alternative Medicine. For more information, call 800-303-3200 or go to thedoctorshow.com. For Discoveries in Alternative Medicine, I'm Roger Cooper.
This program is brought to you in part through a grant from the American Association of Naturopathic Physicians, representing naturopathic doctors, physicians who listen.
If you would like to order a tape or a DVD of today's American Health Journal, please call us at 1-800-303-3200.